Good afternoon, thanks for joining us. I will start with the usual update on the most recent COVID statistics for Scotland. I can confirm that an additional 43 positive cases were confirmed yesterday. That represents 0.9% of people who were newly tested yesterday, and it takes the total number of cases now to 18,890. A full Health Board breakdown will be available later, but the provisional information I have is that 27 of the 43 cases are in the Grampian Health Board area. It's not yet clear how many are connected to the ongoing outbreak in Aberdeen, and I'll say a little bit more about the situation there shortly. A further 5 cases appear to be in the Greater Glasgow and Clyde area, which is a reduction in the numbers that we've seen there in recent days. A total of 262 patients are currently in hospital with confirmed COVID, which is 8 fewer than yesterday. And a total of 4 people are in intensive care with confirmed COVID, which is the same number as yesterday. I'm also pleased to say that in the past 24 hours, yet again, no deaths were registered of patients who had tested positive for COVID over the previous 28 days. And therefore, the number of deaths under that measurement remains 2,491. Obviously, the total number of deaths is still a sharp reminder of the dreadful impact of this virus, and my condolences once again go to everyone who has suffered loss. As always, I also want to thank everyone working hard across the country to help us through this pandemic. The main points I want to cover today are, of course, the outbreak in Aberdeen, but I also want to say something about further measures that we are going to take to try to reduce the risk of transmission. The Economy Secretary will then say a few words about business support, and the Chief Medical Officer will give an update on this year's seasonal flu vaccination programme. Flu vaccination is always important, but this winter in particular, as we face the risk of flu together with the risk of COVID, it is even more important. Before all of that, though, I want to draw your attention to an important announcement made last night. The Scottish Government has taken the decision to add 3 additional countries to the list of those that are subject to quarantine restrictions. Those countries are Belgium, Andorra and the Bahamas. Each of these countries has seen a significant rise in COVID cases over recent days. So from tomorrow, people travelling to Scotland from those countries must self-isolate for 14 days. This is another reminder of how quickly the international situation can change, and it's why I would once again remind everyone to think very carefully about booking non-essential foreign travel. Let me return now to the situation that we're dealing with in Aberdeen. I can confirm that as of now, a total of 101 cases have been confirmed as part of that cluster. That's an increase of 22 on the position we reported yesterday. And a total of 313 close contacts have now been identified and are being followed up, although of course we expect those numbers still to rise further. It was also confirmed yesterday that 2 players from Aberdeen Football Club are amongst those who have tested positive. In addition, a further 6 players have been identified as having been in close proximity with one of those individuals, and they are all therefore self-isolating. It is now clear that all 8 of these players visited a bar in Aberdeen on Saturday night. In doing so, they blatantly broke the rules that had been agreed between the SFA, the SPFL and the Scottish Government, which, to put it mildly, is completely unacceptable. This morning, the Scottish Government convened a meeting with the SFA and the SPFL, and following those discussions, the football authorities have confirmed that the game between Aberdeen and St Johnstone, scheduled for tomorrow in Perth, will not now go ahead. I think that is the right decision. We are expecting members of the public to behave in a highly precautionary manner right now. And when a football club ends up with players infected with COVID,